when we first heard about the opportunity, I got so excited because I realized that, number one, our parents are in trouble. And I didn't really think that our clinicians had the skills. They have skills, but skills that are outcome-based, skills that a clinician could look and see what they're doing, is it effective, and it's outcome oriented. And we're living in a society where everything's based on data, and unfortunately some of the services that we provide, we feel like we do really good work, but can we prove it? And I think with PCIT, it's going to give us the opportunity to do that. It's giving our clinicians. I think
it's going to be very significant for our clients because we do service some very young children, and it's going to really help the parents to be able to improve their interactions with their young child, which once they grasp the techniques and the skills and the trainings and the coachings that we'll be able to teach them, it will improve their interactions that will not only affect them now, but if they continue to use it, it'll affect them even as they become young teenagers.
I am so thrilled to be able to participate in this PCIT training. I had no skills in my toolbox that will work with this population to help the parents to be more involved. We see so many kids that the parents do not have a connection or a relationship with their child, and the skills that we learn here will be able to increase the parent involvement as well as to decrease some of those behaviors that the parents are having with those kids. I really also appreciate the fact that the leaders that taught this training were so hands-on. So now that I have the skills, I am ready to go back and implement with the clients that we serve.
I think it's really important, the fact that it's parent-driven. A lot of our therapies, unfortunately, we don't mean to do it, but we tend to blame parents for whatever ails their kids. But this therapy affords the parents the opportunity to be in a supportive environment. There's no blaming, no shaming, and it helps the parent be the driver. I have to believe that it is cost-effective for our organization. When we received the specs, we recognized there was going to be a cost involved in terms of constructing the space for it, getting the video equipment and buying the toys and all those kinds of things. We recognized that. But our leaders decided that this was something that's worthy of the investment. Again, you're looking at outcomes. I mean, do you want a family? Are we willing to invest in families to make their kids have better lives? And I guess the answer would be yes to that.